So initially, if we want to detect any antibody, that is IgM, and if later on we want to detect any antibody, that is IgG. So serology is the study of immune sera. Serology is a laboratory study in which we detect antigen or antibody in the serum. So, serology is that we are going to take a serum that we are going to centrifuge the blood. We are going to separate the serum and we are detecting antigen or antibodies. So, in serology, all the tests are that either we are detecting antigen or we are detecting antibodies. We are going to have a separate lecture on serology next time. So, antigen and antibody. And these the middle of this table shows some of the examples of these hypersensitivity reactions. So let's deal with each reaction one by one. So hypersensitivity 1, 2, 3, and 4. This is the summary of the previous table. So hypersensitivity one is an immediate reaction. So hypersensitivity one reaction is related to IgE, and it is a sudden immediate reaction in which there are symptoms related to the production of histamine, serotonin, and certain other mediators produced by the mast cells. So hypersensitivity one reaction is an anaphylactic reaction. Again, I'm emphasizing that I'm saying anaphylactic reaction that may convert into an anaphylactic shock, because when we say shock, so we have to fulfill the criteria of shock. So we already know what are the criteria of a shock and what is the definition of a shock. So whenever you say hypersensitivity type 1, that means hypersensitivity type 1 reaction or anaphylactic reaction. So make it very clear while you are saying the words or when you're writing something in the history of the patient, because anaphylactic shock is going to be something else. It requires an initial exposure to antigen to be sensitized. So that means that whenever initially, for the first time, if a person is exposed to any of the antigens, uh, he or she is not going to produce a hypersensitivity 1 reaction. That is the re-exposure to the antigen again is going to cross react with IgE, which is already present and was produced for the first time with the first exposure, and that IgE was acting as a receptor or an antibody on the mast cell. So the mast cells or the basophils, they are going to produce, they are going to expel their mediators which are already present in the cytoplasm of the mast cells, and that is going to produce an immediate inflammatory reaction. So uh, on smooth muscles of the bronchioles and the bronchial tree, there is going to be contraction that will cause shortness of breath and difficulty in breathing. Increased vascular permeability is going to cause edema. So angioedema in hemodynamics we did previously is one of the types of a hypersensitivity type 1 reaction. Wheal and flare again is redness on the skin. So, urticaria or hives is a term used in dermatology. Urticaria is a medical term or a dermatological term, while hives is an English term for urticaria. So, asthma or allergic rhinitis is one of the examples of hypersensitivity type 1 reaction. Bee sting or wasp sting or insect bites can be causes of hypersensitivity type 1 reaction. But make it very clear again that not all type of asthmas can be type 1 hypersensitivity reactions. You're going to go into the details of asthma in your fourth year. So asthma as an entity is a separate disease, but in cases of asthma, because of certain outside stimuli, there can be hypersensitivity type 1 reaction. So these are some of the examples. So antigens can come from the environment, antigens can come from food, antigen can come from pollens of flowers. So it will produce edema, can produce redness or allergy, itching, and shortness of breath. So these are the initial immediate symptoms, and you don't have to go for any special particular test. So again, emphasizing very strongly that the history is very very important. The patient is going to come in the emergency. He or she is not going to come in an outdoor. It is an immediate reaction. The patient is going to land in emergency, and certain questions are enough for the treatment. You have to take a good history quickly, and you have to diagnose that it is type 1 hypersensitivity reaction before it can become an anaphylactic shock. So here is a list of all the antigens or the stimuli that can be proteins from the foreign serum even, or vaccines, or any type of medicines. So medicines or drugs can produce hypersensitivity type 1 reaction, like penicillin, like cephalosporin, like any other component in a tablet or a syrup. So hypersensitivity type 1 reaction can occur because of the drugs. So you don't have to use that drug again and again if the patient is having that hypersensitivity reaction. So food, plant pollens, and then certain insect bites can cause hypersensitivity type 1 reaction. So IgE is important. So this is a table to summarize what we talked about hypersensitivity type 1 reaction. So see this, that the route of entry may be intravenous, can be subcutaneous, can be inhalation, or can be oral, but the symptoms are going to be produced immediately. So that is why it is called an immediate reaction. So the treatment uh, is an immediate emergency options or treatment, and you have to give anti-allergies and antihistamines. So this is the diagrammatic representation of pathogenesis of type 1 hypersensitivity reaction. Mast cells are involved. IgE antibody already produced with the previous first exposure. They are present on the mast cells. Again, when the antigen is exposed, uh, and mast cells are the the antibody present on the mast cells, they are exposed to the allergen or the antigen. They are going to form an antigen antibody complex, and they are going to expel the histamine, serotonin, and many other mediators. Same way, a bee sting or any insect bite can cause type 1 hypersensitivity reaction. So mast cell is important. This is a diagram from your book. So this diagrams actually give the entire summary of type 1 hypersensitivity reaction. You may get this diagram in your OSPE, uh, and questions may be asked regarding type 1 hypersensitivity reaction. So anaphylaxis can be anaphylaxis or anaphylactic reaction is one and the same things. So it is not shock yet, but if the criteria is fulfilled for the definition of a shock, then you are going to call it an anaphylactic shock, and the patient is going to be in ICU in case of anaphylactic shock. Hypersensitivity type 2 reaction is an antibody mediated cytotoxicity, antibody mediated reaction. It may be associated with certain autoimmune diseases. IgG and IgM are involved, and IgG or IgM reacts with membrane associated antigens on the surface of the cell, and the complement system is activated, as I told you already, that whenever there is an antigen antibody complex formation, there is going to be activation of the complement system. So again, you can see in the examples, we have drugs. So drugs can cause hypersensitivity one reaction. Drugs can cause hypersensitivity two reaction also. That depends again on the mechanism of hypersensitivity. So drugs can produce both. So drugs can be allergen. Blood transfusion reaction is one of the best examples of type 2 hypersensitivity reaction. Hemolytic disease in the newborn, that is incompatibility of Rh factor. So it is that antibody dependent cytotoxicity. Complement dependent red blood cell lysis is one of the examples. Antibody dependent red cell degradation, and then antibody dependent cell mediated cytotoxicity. That means that sometimes the cytotoxic T cells, they are also activated to cause death of the body cells. This is showing you that the antibodies are going to attach to the antigen which is already present on the surface of a cell. Again emphasizing, make it very clear, the antigen in case of hypersensitivity type 2 reaction is present or attached to the surface of the cell. The antibody is going to come and it is going to attach to that antigen attached already to the surface of the cell or present already on the surface of the cell, and then it is going to activate the complement because of the formation of antigen antibody complex. Antigen in case of type 1 reaction was free. Antigen in case of type 2 reaction is already part of the cell surface. I hope you are clear with the concept. So this is a diagram from your physiology book, and this is hemolytic incompatibility of Rh factor. If the first pregnancy is positive and the mother is negative, there are going to be formation of anti uh, bodies in the mother. In the second pregnancy, there is going to be type 2 hypersensitivity reaction, and that may cause fetal death. So it is important to know the blood group at the time of birth, and you have to know the the blood group of the mother and the father also, so that you can give uh, antibodies against those existing antibodies. That means antibodies before the second pregnancy. So again, the antigen is present on the surface of the cell. Antibody is going to come and attach to the antigen. And this is that sometimes cytotoxic T cells or natural killer cells are also activated in type 2 hypersensitivity reaction to cause the death or to be one of the culprits in the reactions. Type 3 hypersensitivity reaction is immune complex mediated. It is that the antigen is free, the antibody is free. Neither of them is attached to any of the surfaces. So they are going to form a complex first, then they're going to deposit in the tissue or on any surface, and then they are going to cause the inflammatory or the reaction. So immune complex mediated means that first antigen antibody complex is formed, it is going to deposit on the surface or in the tissues, and then it is going to activate the complement and the inflammatory mediators. And type 4 is a delayed type of hypersensitivity reaction that doesn't involve uh, any antibody directly, but yes, antibodies are involved, but not directly, because T cells and macrophages are involved. And one of the best examples is formation of a granuloma which we did in our chronic inflammation. So granulomas are actually delayed type of hypersensitivity reaction. Again, emphasizing on type 2 and 3. Type 2 is antigen is present already on the surface of a cell. Antibody is going to come and going to attach and form an antigen antibody complex. In case of 3, antigen and antibody both are free. They are going to form a complex first, and then they are going to get deposited anywhere in the body, and then they are going to activate the complement. So type 3 hypersensitivity reaction, if it can be a localized reaction that is called an Arthus reaction. It can be a generalized reaction that is called a serum sickness. It is not a shock. Please make it very clear. It is not shock. It is called serum sickness because the antigen antibodies, they are present in the blood, and they can deposit anywhere in the body and then produce symptoms or inflammatory reaction in any of the organs or the tissue. But in cases of localized reaction, it is mostly a type of a vasculitis locally, and that is called an Arthus reaction. So type 3 is immune complex mediated antigen antibody. They are free. They are going to attach to each other. Then the antigen antibody complex is going to deposit in the tissues, and that deposition is going to cause damage to that tissue by activating first the complement system, and then uh, the mediators or the inflammatory reaction. So one thing, if there is an MCQ that which system is activated first whenever there is an antigen antibody complex formation, that is the complement system. Or if there is an MCQ that following is going to occur first whenever there is antigen antibody complex formation, so the answer is going to be the activation of complement system. Hypersensitivity type 3, let's summarize. In case of type 1 hypersensitivity reaction, the antibody was present on the surface of the mast cell. Antigen came from the external source, formed antigen antibody complex, and the reaction occurred. In case of type 2, antigen was present on the surface of the cell. Antibody came attached to that antigen and formed antigen antibody complex, and the reaction occurred. In case of 3, antigen and antibody both were free. They formed a complex, and then they got deposited in the tissues or anywhere in the body and produced a reaction. Make it very clear that drug reactions can be either of these three. So drugs can produce type 1 hypersensitivity reaction, type 2 hypersensitivity reaction, or type 3 hypersensitivity reaction. So that depends upon the drug, that depends upon the mechanism, what is occurring inside the body, and the type of the antigen and type of the antibody taking part in the mechanism. So glomerulonephritis it can be type 2 hypersensitivity reaction, or it can be type 3 hypersensitivity reaction, depending on the mechanism. So glomerulonephritis in case of 3 is going to be that antigen antibody complex is going to get deposit in the glomeruli, and then they are going to damage. So glomerulonephritis mostly is type 3 hypersensitivity reaction, but type 2 hypersensitivity reaction is can also be one of the examples of glomerulonephritis. Again, that depends upon the type of the antigen antibody and the type of the stimulus. So this is hypersensitivity type 3. So this is the summary of type 1, 2, and 3. So see this IgE is involved in 1, IgG is involved in 2 and 3. Antigen is soluble antigen in case of 1, in case of 2, cell or a matrix associated antigen. And then that means that the antigen is present on the surface of a cell. And in case of 3, it is a soluble antigen. In case of 1, mast cells are involved. In case of 2, macrophages and natural killer cells can be involved. And in case 3, again, different types of inflammatory cells, including eosinophils, including the macrophages, even the mast cells can be involved, but they are not involved as they are involved in type 1. Type 4 hypersensitivity reaction is a delayed type of hypersensitivity reaction. And as I told you that one of the best examples is formation of granulomas. Another example is poison IV contact. So sometimes if you have contact with a poisonous plant, that may cause a delay type of hypersensitivity reaction. A heptan is a type of antigen that is not an antigen initially or from the very start. It is a small molecule, but it can become an antigen if it is attached to a bigger molecule inside the body. So heptan is a small molecule that may be a molecule of a drug or a molecule from anywhere in the environment, but it cannot cause hypersensitivity reaction or any immune reaction either, even in the body, until and unless it is attached to a bigger molecule in the body, and that bigger molecule may be albumin or uh, globulin in the body. So it is going to first attach to albumin or a globulin molecule, and it becomes big enough to be recognized by our immune system. So a heptan is an antigen, which is a small molecular weight molecule, and it is going to produce symptoms when it is attaching to a bigger molecule. So type 4 hypersensitivity reaction has a sensitization phase and an effector phase. Sensitization phase is that, as we did in tuberculosis, there are T cells and there are macrophages. The antigen presenting cells, which are macrophages, are going to present the antigen of the bacteria to the T cells, and then T cells are going to give signals to the macrophage to form much stronger cells, which are epithelioid cells. And then they are going to form a cluster of epithelioid cells around the bacteria, because these bacteria, like tuberculosis, they are not killed by neutrophils initially. So they are going to form a covering in the form of a granuloma around these bacteria to cause their death slowly. And that is why it is a delayed type of a hypersensitivity reaction. A hypersensitivity type 4 reaction can be a contact dermatitis also. So contact dermatitis is another example of a hypersensitivity type 4 reaction. So contact dermatitis can be with contact uh, from plants, or a very good example is, uh, you can see in the picture, a rubber, or sometimes a jewelry, which can affect the skin. So nickel, iron, or copper can be one of the uh, culprits. So a contact dermatitis is a delayed type of hypersensitivity reaction. Again, there is going to be a T cell reaction. So this is a picture showing granulomas, formation of a modified macrophage, which are epithelioid cells. The epithelioid cells are going to form rounded uh, covering around the cause. And granulomatous inflammation can occur in certain bacterial infections, in fungal infections, in certain parasitic infection. One of them is schistosomiasis. Viral infections cannot cause granuloma formation. Then there can be granulomas forming against certain external particles like carbon or silica or any other. And there is a long list of etiological factors causing chronic granulomatous disease. Same way, it is a delay type of hypersensitivity reaction. And as we did in the inflammatory the chapter of inflammation, that granulomas are always formed in a chronic uh, inflammatory process. So you are never going to see granulomas in any of the acute inflammatory processes. So again, delayed type of hypersensitivity reaction is the symptoms are seen after a period of time. So you are going to have a contact with a plant or a metal or anything else, or maybe a bacteria in case of tuberculosis. So you're going to have a delayed type of hypersensitivity reaction. So this is a slide showing granulomas. So this is type 4 hypersensitivity reaction. You can have T helper 1 cells, you can have T helper 2 cells, and you can have cytotoxic T lymphocytes. So the antigen in all these cases, they are soluble antigen, and in case of the last, it is cell associated antigen. And the effector mechanism is that macrophages are activated and they are going to form epithelioid cells. In case of T helper cell type 2, IgE may be produced, and eosinophils are one of the part of the inflammation. And this type of delay type of hypersensitivity reaction is going to occur mostly in cases of parasitic infection. So eotaxin is produced, which is eotaxin is produced by eosinophils, which is one of the mediators which is going to kill the parasites. And cytotoxic T cell cytotoxicity is that the antigen is present on the surface, and cytotoxic T cell is directly going to attach to that antigen and cause the inflammatory process. So contact dermatitis, allergic rhinitis, that can be a chronic, that is actually a chronic allergic rhinitis, chronic asthma, and tuberculosis. These are some of the examples of type 4 hypersensitivity reactions. So just giving you an example before we go to the autoimmune diseases in the next lectures, that in autoimmune diseases, type 1 hypersensitivity reaction is out. So you may have type 2, 3, or 4 hypersensitivity reaction in autoimmune diseases. And again, regarding drugs or drug reactions, you may have type 1, 2, and 3 hypersensitivity reactions if you are talking about any of the drug reactions. So the clinical history is very, very important. The mechanism is very important, that you have to know what is going on inside the body. And as you have seen, that we don't have to go for certain tests to diagnose these hypersensitivity reactions. So hypersensitivity reactions are clinical diagnosis. You have to diagnose these clinically. So a very, very good history is important. A detailed good history and examination is important. Lastly, this is the summary of all the hypersensitivity reactions we did today. So you have to know the antigens which are involved. You have to know the antibody, where it is present, either soluble or present on the surface. You have to know the effector mechanism, and then certain examples of each regarding your third year course. So again, this is a table just to summarize. So A is anaphylaxis, C is cytotoxic, uh, I is immune complex, and D is delayed. This is just how to remember the four hypersensitivity reactions. So this was all about the hypersensitivity reactions. We are going to go with another topic next time, and that is serological techniques.